The biggest mistake most of the clinicians do is to instruct their lab, fabricate zirconia crown for X tooth with a Y shade. Lab note ends. Did we ask ourselves which zirconia, which region, what's the primary goal, strength or aesthetics or a combination of both? That's where basic understanding of 3Y, 4Y and 5Y comes in. So if strength is the primary goal, choose 3Y, which is 100% tetragonal face. Bruxer Original, Bruxer HT, Zircad LT and Zircad Prime Core. If aesthetics is the primary goal, choose 5Y, 50% tetragonal, 50% cubic. Bruxer Anterior, Bruxer Aesthetics, Cube X2, Katana Block, Katana STML, Zircad Prime Incisal. If a combination of strength and aesthetics is desired, choose 4Y, 75% tetragonal and 25% cubic. 3M chairside zirconia, Argent Z HT, Lava Aesthetic, Zircad MT. Hope now you know what to choose, when to choose, and what instructions have to be given to the lab accordingly. Stay tuned for part 3. Don't forget to save it and share it. Take care.